What are some ways, this is a personal question, what are some ways that we can treat fine lines and wrinkles that are not Botox? So you're mentioning collagen production,
Totally.
skincare, LED, all of that. I got
Yes.
Botox poisoning a year ago, and so it's
Wow.
not an option for me right now. It's been a year since I've gotten it. And, I'm seeing I don't have static lines, but I have dynamic lines, and I'm
Yes.
I'm not a fan,
Uh-huh.
admittedly,
Of what?
um, of the lines. Like
Oh,
it's
okay.
mostly like my crow's feet,
Yeah.
my eye area. I know that there are things like microneedling and
Yeah.
various lasers, but I know a lot of people are seeking out alternatives, whether it's for health issues or just not being able to afford it and the upkeep of doing it every few months. So, what are some of those things that we can do to help alleviate some of that that movement and work on collagen production?
Looking at you, the number one thing, if you haven't gotten, my team's gonna get you the LED eyewear, the Eyewear Pro, product. They look like goggles, and it's LED light, 3 minutes a day. LED is a game changer, and so someone like you who is not, because you would be great with Botox too, right? Do I think if you did Botox, you should still think about truly building collagen? 1,000%. That's really important because, again, Botox does slow down the wear and tear, but Botox does not build collagen, right? So you want collagen production. So that is why I love LED. We do it in the practice, and that was the inspiration for creating an at-home product. And then when we looked to really develop it, engineer it, the key thing was to make a product that was easy to use, and that translates into 3 minutes a day as opposed to 15, 18 minutes. That's unrealistic. And the key thing about LED is the skin wants treatment every single day. Once you LED is an ingredient, right? You don't think of it as like something like a cream or a serum, but to the skin, it works through receptors, right? Which is nothing more than just like a doorway, a gateway that lets it in, right? And there are receptors for it. And every ingredient has a different kind of receptor, which is why I said you want to create a cocktail of ingredients to maybe build your collagen, to firm your skin. You want to tantalize and stimulate and use all those openings, literally all those open doorways. You want to find different ways to feed the stimulation, to feed the skin cells that make collagen. So LED is an ingredient. It's a light. You can't really touch it. It has no weight, but it works through a certain mechanism that is fundamental for all ingredients. It is probably the strongest ingredient, I think, that you can use right now, looking off the top of my head. LED. I think that as long as you're willing to put in the time, which is 3 minutes a day, and by the way, you can multitask with it.
You can have your eyes open?
Yes, you can.
Wow, game changer.
Game changer. You're right. That was key. It's snug against the skin. Um, it releases a really good dose of LED red light, which is proven to stimulate collagen. And you got to be patient. It's not like Botox where it kicks in the finite number of days. But you know what? Um, you really get the reward. You start to see the results 4 weeks, definitely in 6. Those before and afters on our box are true. There's no fudging it. FDA cleared it, and that's key. That's a bona fide way. So, I have a lot of patients who are, maybe they don't have the Botox poisoning story, you know, but they're just, for reasons you just said. It isn't, and that's what I was trying to say earlier. You got to find out what's in your heart. People don't want a needle. They don't want something foreign injected. It's been proven to be safe over these years, but what's good for you? And you have options. That's one.
Yeah. I think that red light is definitely having a moment right now, and there are so many red light products out there. So what should people be looking for in red light, and what sets yours apart from others on the market?
So LED red is first and foremost a Food and Drug Administration recognized means by which collagen production is stimulated, right? That is, and say what you want, but the FDA, I think, is really protecting the consumer. So the first thing I would say is look for FDA cleared, right? that means that the data and the product has been approved to make that claim. It's a big deal. Then after you do that, I would say you have to really look at the instructions because you got to follow the instructions, you know. And so if you're the timing, it's got to be practical. It's got to fit into your lifestyle. Some people may want to spend more than 3 minutes a day, for example. In our research, we found that in order to get people to really use it and to get the results that we promise, we had to make it easy. But maybe people want a greater experience, you know. And that's great too. But I think the FDA clearance is number one.
So that's what people should look for when it comes to, and not all red light
Not anymore.
devices have
Not
that.
anymore.
Interesting.
Uh-huh. Really important. I'm so glad we talked about this.
Mhm.
Yes, you have to really look for that on the label because and talk about language, right? So we talk about LED, and then you segued into red.
Oh, red light.
Right. Well, are they really, really the same thing? Not really. You know, LED red light is different than the red light on a Christmas tree.
Right.
You know, and yet you start to see products that just shine a red light on your face, but they're not FDA cleared to say that they stimulate collagen.
Interesting.
Be careful.
I have a question around this as well, and it's a question that a lot of my followers ask. Skincare before you use the device, or do you do it with nothing on your skin and then do your skincare after?
Nothing on your skin.
Okay. So that it penetrates it?
Exactly.
Okay.
Exactly. So, and it's just, don't memorize, just understand it. If there's anything on your skin, it's going to block the penetration of these very delicate light rays, right? And by the way, we talk about there's a high enough energy to only make it required that you need it for 3 minutes a day. That's a function of the energy, right? But nonetheless, there's no heat. You don't feel, there's no chance of burning from LED. So it tells you that the energy, yes, it's high, but it doesn't have that kind of energy to make your skin heat up. So you put a little foundation or some sunscreen or a serum, it'll block those delicate rays. The answer is clean, dry skin.
Got it.
First.
And another thing that I wanted to ask, I don't know if this is a myth. I haven't personally seen it, but people have asked me if it can affect the fat or the tissue underneath like the superficial layer of your skin in a negative way.
Not in a negative way.
Okay.
No. It goes beyond that. You know, sometimes it also, LED red light, like we have a larger mask for the entire face, right? That product is great for redness as well. You know, it's been proven to help on redness. And then the LED blue light, any complexion problem, it's you know, an at-home treatment for what we've been doing in the office for years, you know? So only healthy stuff.